Hello, this is Amanda Brummett with the Working Well in Capel Committee at the Capel Chamber of Commerce. I'm here today with Dr. Farhana Kazi. She's a cardiologist with Affinity Heart Care here in Capel. Thanks for being here, Dr. Kazi.
Thank you, Amanda. Thanks for having me.
Absolutely. So today, Dr. Kazi is going to dispel some myths for us about coronavirus and COVID-19. Dr. Kazi, I will let you dive in.
Okay, well, this is a journal question, and this is just my observation and what people have been asking me. So there's a lot of things going on internet, social media, some on the news, and a lot of it is unreliable. One common thing that people actually have asked me is hydroxychloroquine, and they've asked me to prescribe it for them, or so they can have it. So first of all, we initially there was some observation, but now we know that it doesn't help and it may even hurt people. It has been related to increased risk of cardiac arrhythmias and deaths. So if you're taking it for another reason, like rheumatoid arthritis or some other reason, yeah, that's fine. But there's a huge shortage of that medicine because of this myth that went around. So I would say, please talk to your doctor. And yes, you don't need to have a stock of that in your cabinet if you get any symptoms of COVID. So that's a common thing I've seen. The other thing that I'm noticing that now they're encouraging everybody to wear a face mask, and that is a very good thing because the face mask is to protect you from spreading the virus. Okay, it's not protecting well, it's protecting other people too, but essentially your droplets stay within the mask. And people are wearing gloves a lot too, which is okay if you go grocery shopping and you're touching different things and you don't know who's touched those things, or in an open space. But just using the same gloves the whole day, from morning to evening at your house, then outside and everywhere, actually you may be transmitting more germs that way, or more virus if you're communicating that. Then so I would say hand washing is very, very important. If you do go in a grocery store, they always have hand sanitizers there or the wipes there. I would wipe your cart and then do your grocery shopping and just go wash your hand for 20 seconds like we've been promoting, rather than wear gloves and then you bring the same gloves at home and then you don't know when to take it off. So would be a good thing. Other thing that I'm interestingly hearing is about black pepper. I don't know if you guys have heard or not. It has quarantine, one of the thing that has it's a it's a herb actually, but has been shown in some countries, especially China and India, that it has immunological properties. So I've been hearing people eating spoons of black pepper or putting on their soups, and I don't know if that's helpful. We don't have any proof or anything like that. Bleach is a big problem because I see people washing their clothes in bleach, burning their hands with bleach, and even in my own household, my housekeeper is trying to use too much bleach. I have to tell her, stop doing this. It's okay. You can't spray bleach everywhere. It's okay. Wipe it. And every day, it's for bleach. Definitely do not ingest it because it's going to be really harmful. One other thing that I've noticed is alcohol consumption has gone up in the last few weeks, and it may be related to stress. People are sitting at home, they have nothing to do, so they're just buying and consuming more alcohol. But there's also some myth that if they drink alcohol, it'll kill the virus. So that's not happening. There's no proof. Otherwise, so many people wouldn't have died if they could just ingest alcohol and get better. Yeah. So I think those are some of the myths that I think some people have asked me that, can mosquito spread the virus or house flies spread the virus? Definitely, we don't have any. We don't think that these viruses can last on these insects. We know it's a respiratory virus, so it's through droplets, and the droplets are very small. And I don't think we don't know if these insects can carry these droplets or not, but not that we know of.
Okay, very good. So thank you so much for dispelling some of those myths. We really appreciate your time. And again, everyone, it's Dr. Farhana Kazi, cardiologist at Affinity Heart Care here in Capel. Thank you.
Thank you, Brenda. Thank you for having me.